about setting intention when we're doing wound care with our babies. That is what we are talking about right now. I am going to save this to my feed for future reference if anyone needs it. So I worked with a family yesterday, and I was talking about how they're gaining some scar tissue, and they're not even a full week post out from a frenectomy, which is releasing the frenulums in the mouth, frena in the mouth. And I was talking about how I was telling mom we need to set better intention when we're doing the wound care versus just going in and getting it done. This is a little different from what I normally tell parents, and I'm going to talk about why that is, but I got a message from somebody that said, what do you mean by that? We're doing a revision, which means they already had the release. There was some scar tissue that built up, so they're having to do a revision, and they're wanting to look at things more holistically, better, differently, making sure they're getting all the areas that need to be looked at. So when you're doing your wound care, I always tell parents, you're going into the same space that is not a comfort space for them. So your bedroom floor, put a mat there. You're going to that same space every time you're doing the wound care. Dark, you're being quick. You're going in, you're doing the wound care, and you're ending it. You're moving baby away. We're not saying a lot, meaning, oh, I'm so sorry. I know that this sucks. Let's do it. 1, 2, 3, count to fill that space, and then we're leaving, and then we can reconnect with baby. Okay. Because it does suck. It is traumatic and it's hard. And so with this particular family, she has already done it with 2 of her other children. So this is her 3rd that she's done this procedure with. And when she was showing me, I said, show me how you're doing it. She was very closed off, turned off, did the stretches, the wound care, and that was it. And then I went in baby's mouth, and I did wound care too before I asked mom to show me. So I went in again, and I had to do more of like an oral play versus a wound care for her to really release the tension in this space. Okay, so she got her tongue and her lip clip. So let's just say you're in there and you did your stretch, right? You're doing your wound care, you're moving the wound, and now you're done. What's important is that we're also leaving the space with that trauma. So we gave movement into the wound, and then we left it there. So most of the time I'm telling parents, look, you're going to continue your oral play because now you're out and about and you're engaging with the mouth in a playful and intentional way. That's how we teach oral play, right? Wound care is different than that. Many times parents do wound care and they leave oral play out right now because they just feel like it's too much, when really it's 2 different things. So I told her, yes, you're getting the range that you need, but then the supporting muscles around it are anchoring it down so that in everyday life, it's not moving like we want it to. So when I say be more intentional with your wound care, I want you to put yourself back in it a bit. When you are parent and you're doing wound care for your child, you are setting intentions without even knowing it, but you are telling your mind, this is going to work. She's going to relax. It's going to give her so much more free movement. We're going to be good feeders. We're going to be good sleepers. Whatever it is that sent you into that release, you're consciously talking about it in your mind, subconsciously, and that guides your intention. She was so robotic with it because she's been here before. It's been traumatic, and so we need to bring a little bit of her back into it. So setting your intention, going slower with your movements. We do want to go fast, but if you can go in and elevate and then sit, go into your supporting muscles. So if she got the lip done, go into your supporting muscle in the cheek and just sit, right? And allow baby to move freely without tension in the body. So when you're doing this and they're crying, right, that's building tension in the body. When you are here and you just sit and allow them to relax underneath you, the change can be dramatic. You can still go fast. We don't need to sit there forever. But this 1, 2, 3, 4, 5, and this 1, 2, 3, 4, 5 gives you the same wound care, but brings in a bit more intention and space, allows baby some space, which can really relax the supporting muscles around what's been released. Same idea for the tongue. And so slowing down sometimes might freak people out because baby is crying, but once they relax underneath you and realize that this is okay, you can do both at the same time. The other part is, if you don't want to do that, if you just want to go in and do the wound care and call it a day because it's traumatic for you and baby and you don't want to sit in that space, then we're going to be pulling them out and we're going to do oral play outside in their open space, in their play space, and engage opposite muscles. So if you've had lip and tongue done, then we're going to sit in the cheek space. What if you had lip, tongue, and cheeks? Then we're going to sit on the gum line. Okay? And we're just offering this free movement and safe space to help the tissues relax. Okay, think about like any other injury you have. I think about my C-section scar. So the C-section scar is there. We're doing all of this manipulation to release those adhesions. But on weeks where I'm extremely stressed, my therapist will say, look, that's where your body will hold on. You're holding on, or there's a trauma that you've experienced and you're not letting it go. And it's keeping this one spot tension and tight and not releasing. So your body has physical restrictions, but we have to remember that the emotional connections can play a role in that too. And because it is traumatic, like this can be released from a physical point of view, but if all of these muscles are tightening around it to guard it, we need to look at that too, because then you're going to have this tension building here and it's going to reduce the natural movement of the mouth and the tongue and wherever you were released, and that's going to impact scar tissue. Okay, so I'm going to answer some questions if you have anything about that. My 2.5-year-old son doesn't eat solids. Okay. This is about wound care. So your 2.5-year-old doesn't eat solids. We definitely need to get an assessment from somebody. So in your area, you would look for a feeding therapist, OT or speech therapy that works with that particular age group. Because at that age, there's so many components into it that we would need to look at. Is the sitting happening when you are doing the wound care oral play? If they are crying, how will they relax? Yes. So it depends on you and your baby and what you are feeling. So with that particular mom, no, she's going to have to do wound care, and then we're going to have to do something separate. And I think I kind of described it, right? So for her, when baby was asleep by the end of the session, I showed her, look, go into the corner of the wound and we're just going to sit while baby's sleeping. And the baby did wonderful. And you could see her whole mouth sort of relax around mom's finger. Okay, you guys are going to have to tell me if you can still hear me because my phone did something weird just now. And so then we did the other corner and baby relaxed with it. When I went in and did wound care, I was able to get baby to calm with my finger in the wound care space. So But I was really intentional because when I saw it and I realized what was going on, I changed the way I was approaching things too. Okay, you can hear me good. I just scrolled down. So either baby is going to be crying, but if you are in that space and you're doing one of the stretches and you pause, you're still getting the stretch and you're pausing to allow to see if baby will calm in it. If that, it's really up to the parent too. If that's too much, have your wound care and oral play separate. That's how I teach it. And so I think it just depends on the dynamic of the family. Can you give an example? Oral play. So I have the oral play guide where I have tons of oral play activities. It's on my website and it's linked in my bio, and it's pretty much on every post. You can comment to get a link to it. But I'm also doing a 5-day challenge. If you go into my stories, it's free. And I'll give examples of, some of them are going to be body movement, but some oral in that 5-day challenge, if that interests you too. Is it too late to start 2.5 years after the toddler hates anything in his mouth? No, it's never too late. You know, I work with adults on this kind of, on oral movement and function. So it's never too late to start. What's hard about toddlers is that, you know, they start to have an opinion and they start to want that independence. And so you have to make it engaging for them in a different way. The oral play guide has activities with kids showing the activities up to age 7, and I add things constantly in it. So there's no stop point. You can go through phases where it's a bit more difficult for them to engage, but keeping that routine is really important. So I would really start super small. I don't know how teeth brushing is going for you guys, but starting with at teeth brushing, then we can just start with them looking in the mirror, opening their mouth, and like touching their tongue, right? 10 times, like just engaging them, having choices for them, showing them the videos of the other kids doing it. I've had parents say that when my kid watches the kids in the guide doing the activities, they imitate, and that is much better than mom trying to do it, because no toddler wants to listen to mom. But it's never too late, no. We meet with our lactation consultant tomorrow for our 2-week-old. He's showing signs of possible posterior. I have the oral play guide from the first baby. So I would focus on that deep under U activity. So under tongue activities in the infant section, go to the bottom video. And if it's a posterior tie, we want to make sure it's the frenulum and not tension, because cranial nerve compression, tension from any number of things, right, can show the same signs as a posterior tongue tie. But if you get deep and under into the tongue, you will see change. And that would be like your pre-work to make sure that we're releasing the tension so that the frenulum can, one, move the way it's intended so it can show us, okay, is it a true tie? And two, it really supports the overall release. When you have all that tension away from the frenulum, they can get as deep as they need to. Never thought of doing them together, like the wound care and the release, like the intention at the same time. It doesn't work all the time. It really depends on the family. But yeah, it was really nice to see. So you totally can. Hello, Jenna. Okay, that was really quick. I just wanted to come on and talk about setting that intention. If anybody has any quick questions about releases or revisions, drop it below and I'll add it in this little talk. But somebody reached out and wanted to know just, what do you mean by setting the intention with wound care? Because they were having some scar tissue and they were having to go into a revision, which means they have to do a second release. And they're just wanting to make sure they hit all of the areas. So you can either set your intention outside of wound care and do your oral play, engaging with the muscles and relaxing that space outside of wound care, or you can do it within wound care if your dynamic allows that. We still want it to be quick. And we still want to make sure we're giving them all the movement that the wound care requires. But sometimes sitting in that space can be really, really helpful for really both of you, because even if baby like calms for a second while you're in that space, like that comfort washes over you as mom too. All right, you guys, this will be saved in case anybody needs or wants it. And I will see you guys later. Oh, wait. How long does wound care typically last and how often you're doing it? That's release provider dependent. I've heard so many different variations. The release provider that I most commonly work with is 4 to 6 weeks, 4 to 6 hours. Sometimes it's every 3 hours for the first 48 hours after release, and then you sort of knock it down to, 7 times a day, and then 5 times a day, and then 4 times a day as the weeks go on. Sometimes you are given a number and you go for your week follow-up and it is not moving the way that we would want it to. So they kind of get in there, they do some adhesion releases, right? And then they change the schedule for you. So it's really just, it's release provider dependent. But the more often, the better, because the mouth heals so incredibly fast. And we want to make sure we're getting all that range that we want them to have, and that they don't sit too long in that restricted space. If your baby is already like sleeping through the night, that's probably the toughest thing to adjust to. So I'll tell parents, like, if they're sleeping through the night and you go check on them and you can pull the chin down and they have the tongue suctioned up and you can see a really good stretch, that is lovely. But if you got released and you go in and you pull the chin down and the tongue comes with it, we need to get in there and create some movement. So again, it's also baby dependent too, and how well their pre-work was, how well their motor planning is building. So a lot of it's multi-factored, which I know is not probably the answer you wanted. All right, you guys, I will see you guys later. Bye.